Do you wake up every morning with a sharp, shooting pain that runs from your lower back down through your hip and all the way into your leg? Maybe it's a burning sensation. Maybe it's numbness or tingling in your foot. And the moment you try to swing your legs out of bed and stand up, it hits you. That's sciatica. And for millions of seniors across this country, it's the worst part of waking up. Hi everyone, I'm Dr. Alan Mandell, and welcome back to Healthy Aging America. Today I'm going to show you 4 simple exercises that you can do right where you are, lying in bed, before you ever put your feet on the floor. These movements take just a few minutes. They require 0 equipment, and they're specifically designed to ease pressure on the sciatic nerve and loosen up the muscles that tend to lock up overnight. Stick with me to the end because I'm also going to show you the correct way to actually get out of bed afterward, which is just as important as the exercises themselves. If you're new here, welcome, and please consider subscribing because every week I share practical, easy-to-follow tips to help you move better, feel better, and stay independent as you age. Let's get into it. Before we jump into the exercises, I want you to understand why sciatica pain is almost always worse first thing in the morning. It's not your imagination, and there's a real reason behind it. When you lie down for 7 or 8 hours, your spinal discs actually absorb fluid and swell slightly overnight. At the same time, the muscles around your hips and lower back, especially a muscle called the piriformis, can stiffen up from being in one position for so long. The piriformis sits deep in your buttock, and in many people, the sciatic nerve runs right underneath it, or sometimes even through it. When that muscle tightens, it can press directly on the nerve, and that's what creates that radiating pain, tingling, or numbness down your leg. Now here's the problem. Most people wake up and the very first thing they do is throw their legs over the side of the bed and push themselves up quickly. That sudden movement puts a sharp, immediate load on a spine and a nerve that hasn't warmed up at all. It's like trying to sprint without stretching first, except you're doing it to a nerve that's already irritated. That's exactly why so many of you tell me the pain is worst in that first hour of the day. So the goal with these 4 exercises is simple. Gently wake up the spine, loosen the hip muscles, and take pressure off that nerve, all while you're still lying flat and supported by the mattress. This is the safest possible position to do it in. One quick but important safety note before we begin. These exercises are meant to be slow, gentle, and pain-free. If at any point you feel your pain getting sharper, if numbness or weakness in your leg increases, or if you ever lose control of your bladder or bowels, stop and contact your doctor right away. Those can be signs of something more serious that needs medical attention. For the vast majority of you dealing with common sciatic flare-ups, though, these movements should feel like relief, not strain. All right, let's get into the bed. The first exercise is the knee to chest stretch, and this is one of the simplest, most effective ways to take pressure off your lower spine first thing in the morning. Start by lying flat on your back. If you have a pillow under your head, that's fine. Keep it there. Bend both knees so your feet are flat on the mattress. Now, slowly bring your right knee up toward your chest and use both hands to gently hold it there, just below the kneecap. You're not yanking or forcing it, just a slow, controlled pull until you feel a gentle stretch in your lower back and the back of your hip. Hold that for about 15 to 20 seconds, breathing slowly through your nose and out through your mouth. Then gently lower that leg back down and repeat the same thing with your left knee. After you've done one side at a time, if it feels comfortable, you can bring both knees up together and hold both of them against your chest for another 15 to 20 seconds. This is a slightly deeper stretch, so only do this if the single leg version felt completely pain-free. Do this whole sequence 2 to 3 times, alternating legs. What this is doing is flexing your lumbar spine in a very gentle, supported way. It opens up the space between your vertebrae, which can relieve some of that overnight compression on the nerve roots in your lower back. A common mistake I see is people pulling too hard or too fast, trying to force a deeper stretch. Don't do that. The benefit comes from the gentle, sustained hold, not from force. If you have hip or knee replacements, just be mindful and only go as far as is comfortable. There's no need to pull the knee all the way to your chest for this to work. The second exercise targets that piriformis muscle I mentioned earlier, the one that often presses right on the sciatic nerve. Stay lying on your back with both knees bent and feet flat on the bed. Now take your right ankle and rest it on top of your left knee, so you're forming a sort of figure 4 shape with your legs. Then, gently reach down and grab the back of your left thigh, just behind the knee, and slowly pull that leg up and slightly toward your chest. You should feel a stretch deep in the right buttock. That's the piriformis releasing. Hold that for 15 to 20 seconds with slow, steady breathing. Then release, switch sides, and place your left ankle over your right knee, repeating the same gentle pull. Do this 2 to 3 times per side. If reaching behind your thigh is uncomfortable due to shoulder or arm issues, you can loop a towel or a resistance band around your thigh and hold the ends of that instead. It gives you the same pull without straining your shoulder. This stretch is incredibly important because for a lot of you, the piriformis muscle is the actual source of the nerve irritation, not a disc problem at all. Loosening this muscle first thing in the morning, before you put any weight on it, can dramatically reduce that radiating pain down the leg. The third exercise is the pelvic tilt, and this one is less about stretching and more about gently activating and warming up your deep core and lower back muscles before you ask them to support your full body weight. Lying on your back, knees bent, feet flat on the bed, place your hands lightly on your stomach or just let them rest by your sides. Now, very gently, flatten your lower back into the mattress by slightly tilting your pelvis upward, almost like you're tucking your tailbone. You'll feel your abdominal muscles engage just slightly, and you should feel the small of your back press down into the bed. Hold that gentle contraction for about 5 seconds. Then relax and let your back return to its natural curve. Repeat this 10 to 12 times, nice and slow, with steady breathing. This is a very small, subtle movement. You are not arching or lifting your hips off the bed for this version. The goal is simply to wake up the core and lower back muscles in a controlled way, so that when you do stand up, those muscles are ready to support your spine instead of being caught off guard. A lot of sciatica flare-ups happen because the deep, stabilizing muscles around the spine are weak or asleep, and the spine ends up relying too much on the discs and nerves for support. This little pelvic tilt helps reestablish that mind-muscle connection every single morning. The fourth and final exercise is a gentle spinal twist. And this is going to add some rotation and mobility to the spine, which the first three exercises don't really address. Roll slightly onto your back, knees bent, feet flat. Now, keeping your shoulders flat on the mattress, slowly let both knees fall together to one side, say the right side. Let gravity do the work. You're not forcing this. You should feel a gentle stretch through your lower back and the side of your hip. Hold for about 15 seconds, breathing slowly. Then, just as slowly, bring your knees back to center and let them fall over to the left side, holding again for 15 seconds. Repeat this 2 to 3 times on each side. The key here is control. This is not a fast, swinging movement. It's a slow, gravity-assisted rotation. This twist helps mobilize the small joints along your spine, called facet joints, which can also become stiff overnight and contribute to that overall feeling of tightness and discomfort when you first wake up. It also continues to gently stretch the muscles along your sides and lower back that support healthy movement throughout the day. Now, this next part is honestly just as important as the 4 exercises we just did, because I see people undo all that good work the second they try to stand up. Here's the correct sequence. After you finish your stretches, bend both knees and roll yourself onto your side, ideally the side that's less painful. Use your top arm to push against the mattress in front of you for support. Then, using your arms, push yourself up into a seated position on the edge of the bed, letting your legs swing down together as a unit, not one at a time with a twist. Sit there for just a few seconds, take a breath, let your spine adjust to being upright after being horizontal for hours. Then place both feet firmly on the floor, lean slightly forward from your hips, and push up to standing using your legs and arms, not your lower back. What you want to avoid completely is the old habit of just swinging both legs over the side and yanking your upper body up in one quick motion. That combines spinal flexion and rotation under load, while your spine is still stiff, and it is one of the most common ways people trigger a sciatica flare-up first thing in the morning. Let me give you a few more tips to help these exercises actually stick and keep that sciatica pain from coming back. First, think about your sleep position and support. If you sleep on your back, placing a small pillow under your knees can take pressure off your lower spine overnight. If you sleep on your side, placing a pillow between your knees keeps your hips aligned and reduces strain on that piriformis muscle. These small adjustments mean you're putting less stress on the area before you even start your morning routine. Second, consistency matters far more than intensity here. I'd rather you do these 4 exercises gently every single morning than do an aggressive version once and then skip it for a week because you're sore. 2 to 3 minutes every morning is enough to make a real difference over time. Third, try to avoid sitting for long, unbroken stretches during the day. Sitting puts significant pressure on the discs in your lower back and can compress the piriformis against the sciatic nerve, especially in a soft chair or a low couch. Set a timer if you need to, and stand up, walk around your home for a minute or two every 30 to 45 minutes. And fourth, gentle daily walking, even just 10 to 15 minutes, helps keep blood flowing to those muscles and nerves and keeps your spine from stiffening up between your morning stretch sessions. So to recap, knee to chest, the piriformis stretch, the pelvic tilt, and the gentle spinal twist, all done before you get up, followed by that careful side roll method to actually stand. Give this a try tomorrow morning, and honestly, give it a full week before judging the results. Most people start noticing less stiffness and less of that shooting pain within just a few days of doing this consistently. If this video helped you, do me a favor and give it a thumbs up. That really helps more seniors find this information. And please subscribe to Healthy Aging America because I post new videos every week covering exactly this kind of practical advice for joint pain, mobility, and aging well. I'd also love to hear from you in the comments. Tell me, when does your sciatica pain tend to bother you the most? In the morning, after sitting, or something else? It helps me know what to cover next. And if you want to go even deeper on relieving hip and piriformis-related pain, check out the video right here on your screen. I think you'll find it really helpful too. Take care of yourselves, and I'll see you in the next video.